Safecare COVID-19 Antigen Rapid Test Kit for Saliva Test Procedure. Allow the test cassettes, reagents and specimens to equilibrate to room temperature, 15 to 30 degrees Celsius or 59 to 86 degrees Fahrenheit, prior to testing. For best results, the test should be performed in 1 hour. The kit box consists of package insert, extraction tubes, funnels, extraction buffer, test cassettes and workstation. Sample collection. Insert the funnel into the extraction tube. Make a cough from the throat to clear the saliva from deep throat. Then spit saliva into the funnel and let the saliva flow into the tube. Make sure the volume of the saliva should be at the fill line, 300 microries, on the extraction tube. Avoid any saliva contamination of the outer surface of the tube. Put the tube back to the workstation, discard the funnel. Note: do not place anything in the mouth including food, drink, gum or tobacco at least 30 minutes prior to collection. Do the hand hygiene with soap and water or alcohol-based hand rub before sample collection. Test procedure. Unscrew the lid of an extraction buffer. Squeeze the extraction buffer and add all the buffer into the extraction tube. Insert the dropper tip into the extraction tube tightly. Shake the tube to mix the saliva and buffer completely. Remove the test cassette from the sealed pouch. Place the test cassette on a dry, flat surface. Hold the tube vertically upside down over the sample well. Transfer 3 drops specimen into the specimen well of the test device, by gently squeezing the side of the tube. Start the timer and wait for colored lines to appear. Interpret the test results at 15 minutes. Do not read results after 20 minutes. Interpretation of results. Positive result. 2 lines appear. One colored line appears at the control region C, and the other line appears at the test region T. Negative result. One color line appears at region C and no line appears at the test region T. Note: if the test result is negative but clinical symptoms persist, additional testing using other clinical methods is recommended. As with all diagnostic tests, a confirmed diagnosis should only be made by physician after all clinical and laboratory findings have been evaluated. Invalid result. Control C line fails to appear. Insufficient specimen volume or incorrect procedure techniques are the most likely reasons for control line failure. Review the procedure and repeat the test using a new test cassette. Disposal. All parts of the test kit should be discarded according to federal, state and local regulations. Limitation of the test. The procedure is limited to provide a qualitative detection. The intensity of the test line does not necessarily correlate to the concentration of the antigen in the specimens. Negative results do not preclude SARS-CoV-2 infection, and should not be used as the sole basis for patient management decisions. A physician must interpret the results in conjunction with the patient's history, physical findings, and other diagnostic procedures. False negative result can occur if the quantity of SARS-CoV-2 antigens present in the specimen is below the detection threshold of the assay, or the virus has undergone minor amino acid mutations in the target epitope region recognized by the monoclonal antibodies utilized in the test.